mutual funds will help you, and it will help you in a very large extent, but you'll have to keep your patience. On an average, mutual funds would fetch you at around 7 to varies from 7 to 14%. Till date, I have seen around, in last my 15 years of experience, I have seen hardly around a couple of mutual funds out of 700 mutual fund varieties, and nearly 84 mutual fund houses. There are different mutual fund houses which provide the facility of investing in mutual funds. There are 80 companies which do that in form of 800, nearly 700 to 800 different categories. So it will be a very difficult and tedious process for you to just get through all these things and calculate how much is the returns. The other two form of investments are, see, all these things which I said above is more of savings rather than investment. Yes, if you consider investments, yes, the stock market and commodities market as there. Commodities market includes your gold, silver, and the other future contracts, which is a little difficult for me to explain in stipulated time. The commodities market needs a little more experience and a little more varied thinking to when to invest and when to come out of the market, and how to invest and what are the contracts. All these things will take a little time for you to understand. And the commodities market is very, very speculative and very, very tedious also. Coming down to the stock market, yes, the stock market, as everyone say, it is more of a betting counter. No, I wouldn't call it as a betting counter. I would suggest you to stay invested in the stock market, and don't come into the stock. I mean, do not invest in the stock market in the mode of any sort of gambling or quick money gaining process. You treat it as a very good long-term investment. There are 6,000 companies to be invested on, starting from there are varied sectors. There are around 27 sectors, namely banking sector, petroleum sector, you have tire sector, automobile sector, you have sector. There are many more sectors in which you would like to invest. Be firm on the investment, where you want to come into the market and how long you have to stay in the market. Now, the motto of our investment should be like higher the risk, higher the returns. The stock market, I would suggest, I mean, you can never time the market. Every day in the stock market is an investment time, and every day in the market is opportunity, and every day it will give you a fantastic returns. The higher the returns, the higher the risk. This should be our motto. For example, the younger generation of the doctors among you would understand that they'll be much comfortable with taking higher risks, whereas the older, I mean, little aged people or aged doctors like you, I mean, of your group, would like to take a little lower risks. Yes, even for every variety of the investor, this stock market will welcome each and everyone, and you have all the opportunities. Yes, there is a common saying in stock market saying that do not put all your eggs in one basket. Yes, every 100 rupees you put into the your own investments, like all the things I said, deposits, insurances, all those things, I would suggest invest your 40% of your total investments of 100 rupee. 40% is 40 rupees, equally divided into your fixed deposits, your insurances. In insurances, I would suggest only one planning for you is short-term, endowment policies, where you get the returns of the your money invested also. And the planning for entering the stock market, yes, you have to have a demat account, you have to have a trading account and all those things. And then, yes, you'll have to have your own research in the market. Whenever you go to the market, whenever you buy a tire for your vehicle, whenever you buy even your spectacles, Titan is doing that, your spectacles. And Titan is trading now at around 1,800 rupees. Yes, when they left it in the market, it was around 200 rupees. Yes, you can imagine the returns as of today. It is around 880 times of your money in just around 16 times. The other example which I would give you is Page Industries. I don't think many of you know about Page Industries. Page Industries is a company which came out into IPO, that is what we call as initial public offer, in the year 2008, with a IPO price band of 280 to 300 rupees. Now it is trading at around 32,000 rupees. I would just say that yes, you might have heard the brand Jockey. Yeah, Jockey is produced by the same Page Industries. You can imagine the invested 1 lakh invested is now around 3 crores in the stock market. This is what the returns you get. You should have patience, you should have a clarity, you should know the what the company is doing with, and how the management is, and what is the reasonable rate to purchase it, and what is the reasonable rate to exit it. The other example which I would give you is in 2002. I don't know, I mean, how many of you were there are many senior doctors here. If that time, if you had invested at that time, Eicher Motors, which produced Bullet, Bullet vehicle. I hope everyone knows. Royal Enfield brand belongs to Eicher Motors. Eicher Motors was trading at around 5 rupees in 2002, which is now trading at around 27,000 rupees. So instead of buying a Bullet in 2002, if you had invested in the market the same amount of 50,000 rupees, which you would have got a Bullet in 2002, you could have bought around 30 Rolls Royce today. Yeah, that is the returns which stock market gives. Yes, this might look a little fancy, the all the things which I said, but the thing is, you should know which company you are investing in, and what are the produce of the companies are, and how long this produce will sustain in the market, and how long we are going to stay invested in, and where to exact. The trend changes basically stock market is like a cyclical thing. For some years IT will start running, for some years financials will start going up, and some years automobile will start going up. Now the trend is around electric vehicles, as most of you agree with me, and even software companies are on the boom. So I would suggest you to make your own research, and all the take a research and all the finance gain all the knowledge of your financials, and you just have to know your own risk taking capabilities, and you have to stay invested in the stock market for some years at least, till the cyclical things enter. Basically, we are changing into a capitalist nation from socialism, all this communism and all. The government also seems to be pushing towards the capitalist movement and bringing the interest rates very lower and lower each day. So where even the companies are having field day, in taking loans and everything. But the risks in the stock market are, yes, if you are choosing a bad company, a badly managed company, badly, very poorly selected choice of produce they have, and like yes, if you have I mean, problem with shareholding pattern. If it is more of family-owned companies, yes, it is bound to collapse after some years, as the head of the I mean, head of the company or the head of the family goes along with the age, and he will be little tired to take decisions. Yes, the companies have always have to be dynamic and little charming in their producers. This is how you select a company, and there is a lot more to explain, which I don't think so I'll be able to do this. Yes, I on an individual basis any day I can do that. Just like technology has helped the betterment of individual health, technology as of today is playing a great part in the bringing in transparency in the financial health too. See, everything today is on handy. Everything is on your mobile. See, be it your insurance policies, be it your vehicle policies, be it your fixed deposits, your banking apps help, your this thing financial all the financial apps do the help and whatever you're needed. Earlier days when you used to go to the bank, and if you had to check your balance for probably an hour or so, you would have to stand in the queue and look for your bank balance, which is your own money. Now the days have changed, things have changed. There are a lot more things which are very handy on your mobile, which you can take easy access to all your financial needs and financial stabilities which you need to. The second thing, the other thing which I have to tell you is, be very wise in choosing whatever the mutual funds or even insurances. Insurances, be very careful about the company's stability, where you are investing in the you are investing your, be it insurance, be it your be it your stock market investments, be it your mutual funds, or be it even your real estate. You know, real estate things, there are so many poor sufferers who have, I mean, with unknown sellers, they have got involved with and got involved in litigation. Yes, they in government, if you are investing in government bonds, that is much safer, but it is very low yielding. But yes, you have your own guarantees and you have everything in your hand in that. In stock market, yes, this has a very heavy liquidity. So in real estate, if you have to take out your money, you'll have to search for a buyer, you will have to search for the legal opinions, you will have to go stand in the, say, all this process will take around 3 to 5 months. But what happens in stock market? Yes, today you are selling, 2 days after your bank balance shows the what you have sold, and the investment and the returns what you are expecting will come into your hands. So please be wise when you are investing, and please be wise when you are taking advices. When I'm saying advices, I'll give you a small example. When you are I don't know, I mean, how many of you are very choosy about your shirts or pants, or even when you're going to buy your spectacles. When you go to buy spectacles, you at least you would see at least 3 to 4 shops, and 30 pair t-shirt, probably you would have seen 15 to 20 t-shirts, and then choose your own t-shirt according to your money, according to your financials, according to your color choice, according to the texture, all these things. But in stock market, The only foolish thing we all do is we are buying some stock, for example, Idea Vodafone or something like that. Okay, without thinking that what are the company financials, what are the company shareholding patterns, what are the PE ratio, and what is the debt of the company, what is the future of the company, all these things beyond analysis, we just buy, and we fail in the stock market, and ultimately we call the stock market as a gambling den. Please don't do so. Please be wise. Please be choosy. Please be invested for a long time in the stock market. Thanks to by this, I would like to finish my words. Thanks to Mr. President and Mr. General Secretary, Secretary General, Dr. Bharat, for all the opportunity you have given me. If any questions, I would like to take it, sir.
What you know, what Guru?
Yes,
I now understand why Bharat is your close friend. Am I right, Bharat? You know,
sorry.
Guru, I also hail from a business family.
Okay.
And my father had told me a business secret, which I would like to really reveal here. He says
Sure.
business works on 3 C's. One is you first try to convince your customer, failing which you try to corrupt him, failing which you confuse him. So I don't know how I should go about with these things, but this is the true logic of business here. Anyway, Guru, it was a wonderful hearing. I'm sure there'll be quite a few questions because a lot of investors are here in the Department of Orthopedics. So yes. I'm wondering if there's any questions today.
I think Mr. Guru has tried his level best to make us wise in financial life. I think we know how to earn money, but investing and making the money to work for us, I doubt we are that much wise.
Can I put a word here, sir? Yes, most of the doctors which I have seen, sorry for, I mean, if I'm talking a little, I mean, absurd, but most of the doctors are ill-advised with their friends and surroundings because of their investments and the lack of knowledge in investments. So don't take advices from your surroundings or if somebody comes and says you that I am going to do a business and please invest in that, I say most doctors are susceptible to that. Please don't do that. Keep your money safe in your own pockets, not in others' pockets.
We don't believe anybody. That's a big problem.
No, Surya, the best things in life are either illogical or illicit, or these are the best things. Fortunately or unfortunately, we can't help it.
Can I just?
Yes, sir.
Yeah, the best way. I'm the eldest here, I think, amongst all of you. Best advice is don't put all your eggs in the same basket. You should see that you invest in different phases in different ways, and whether it is stock market or whether it is bank, you must distribute yourself so that you are safe.
Yes, correct. No wise advice from here.
Mr. Guru, I will have your number collected from Dr. Bharat.
Yes, sir.
If you ever get an opportunity where to invest now and 10 years later, we can buy some Rolls Royce. Keep me informed, please.
Yeah, definitely. Yes, sir. Yes, I have so many things. Yes, definitely. I would do that. Anytime you just feel free and you find time, you just give me a call, sir. I'll be available any time of the day.
Thanks. Guru, you've already got one customer now. Prospective customer. Okay.
I think
any more questions? Yeah. Shall we go ahead with the next?
Yes,
no more questions? Okay. Can I request Dr. Arvind now to speak on salt and family health?
Yes, sir. Sure, sure. Just a minute, sir. I'll be sharing the slides.
Yeah, sure.
I think Dr. Arvind's topic itself is charming. self and family health, which we lack. We earn money and we will be very good in profession, but hardly we give time to our family. So over to you, sir.
Arvind, are you able to check the screen? I can hear you all, but I'm finding a little difficult to. Vamshi, can you just help him out?
Is it finding it difficult to share his screen?
Yeah. Down you'll have a green button saying share screen. Just a minute. The panel downstairs.
It is green. Share screen.
I'm trying to do that. You've done it earlier before the start of the meet. Yeah. Suddenly it has disappeared. 1 minute. Green button saying share screen. Just a minute. The panel downstairs.
Now, 6 o'clock position, there is a green button. Share screen.
Yeah. Trying to do that. You've done it earlier before the start of the meet. Yeah.
That is called
1 minute.
yeah. Whenever you require, it doesn't work. Murphy's law.
Arvind sir, why don't you just close and open again?
There is a green button. Share screen.
Yeah. Trying to do that. Unfortunately, I'm not able to actually find it.
Do one thing, Arvind sir, why don't you just close your Zoom app and log in again?
Whenever you require, it doesn't work.
Should I log in again?
I think close your Zoom app and you log in again.
Okay.
Close it, open again.
But I think I can
Well, I finish my talk and then
start. The other speakers can talk. I think sir can talk. Continue his talk. Dr. Shantaram Shetty.
It doesn't work.
Should I log in again?
I think close your Zoom app and you log in again.
Dr. Bharat, is someone else talking now? I think.
good evening. Can I go ahead so that we can save some time?
Yes, sir.
Yes, sir. You can.
Sure.
Yes.
Our President, Dr. Shiv Shankar, and our own group of brilliant orthopedic surgeons of the state. I won't name each one of you, and I know you personally do well. And singularly, I can call you as our own children. So I will go on with my talk on life beyond professional life. It is indeed a pleasure to greet each one of you from the institutions I am associated, from the NITE University and from Tejaswini Hospital. And on this, as Rajendra was rightly telling, it was Dr. Rajshekaran who initiated, and we all worked together nearly 10 years to institute this Bone and Joint Day. And it is nice that it is carried on in a big way. To give my own example of my life in orthopedics and beyond, and what is important is doing the right thing at the right time in orthopedic surgery. First of all, let us thank God, each one of us, for sculpturing us to be orthopedic surgeons. It's a God-given gift to each one of us. And my request is utilize it, or you do not, you will spill the opportunity given by God. It was Nicolas André, the French physician, way back in 1741, coined this beautiful word orthopedia. Much water has indeed flown both under the bridge and over the bridge. Since then, and orthopedic knowledge today and innovations have virtually exploded, as all of us know. And the strides made in the last 2 decades in orthopedic surgery perhaps far surpasses in the whole history of mankind. And even when you compare any branch of medicine, we are much ahead. History is the story of creativity of our past masters who questioned why and what, and how and when. It required an Alexander Fleming, or Lord Lister, or Arbuthnot Lane, or John Charnley, or Gabriel Elizardo to explain and create a new order in orthopedic surgery. It is sad that we do not have an Indian name in this illustrious list, but many recently have made an impact in the history of medicine, even international. Gentlemen, change in every sphere of life is mandatory. Look at the car of 1908 and look at the car of today. Change will replace you and put you down to mediocrity if you do not change. Change in every way is the very essence of life. My orthopedic life and beyond, my orthopedic career started in Victoria Hospital as a lecturer in orthopedics in December 1966. These 50 years after my post-graduation in Delhi, and traveling all around the world on many fellowships and work as a teacher for the last 50 years, and deeply involved with the AO group, I have seen the transformation in our specialty, which very few would have experienced, rejoiced, and sometimes even saddened. Look at the Victoria Hospital, that magnificent building stands even today. It was in 1966. It was a very busy outpatient. Even those days, more than 200 patients we used to see. But the wards, as I remember in the first floor, there were 15, the patients were 15 on traction out of the 30 beds, with Vulcan beams, with Thomas splints and bolus traction. 10 were on plasters, some were on floor beds, sometimes even foul-smelling plasters, which was a common feature. I still remember how we used to struggle fixing both bones of the forearm with a hand drill, and Sherman's plate fixing a fracture neck of femur with an SP nail, with the X-ray room 2 floors down for an X-ray film to be washed and brought. The theaters were mediocre with little discipline. In these 54 years, gentlemen, we have changed into most sophisticated hospitals with every facility and comparable to the best hospitals in the world. Look at the Bagby plate of 1956 and see the transformation of semitubular plate 61, DCP 69, and the LCTCP in 1981. And the different types of locking plates today. Every bone has an anatomical locking plate. Look at the era of anatomical plates where we can fix it very comfortably and to the anatomical shape of the bone. Look at the joints. Ever since John Charnley, that great visionary, gave us the joint replacement of the hip. And from 1950, it went on. The different bearing surfaces, as you see, from ceramic from metal on metal to ceramics, and every mode, and almost it is changing every other day. Look at the knee, 1953, Waldes hinge bicondylar total prosthesis, to the different bearing platforms today, and to perfection, and to improve the function, even the flexion of the knee. From mediocre theaters, we have moved into sophisticated laminar flow theaters with navigation. From crude from crude nursing support to well-trained ORP support, and with the biotechnological pursuits and better understanding of bone healing, imaging, joint replacement, keyhole surgeries, nanotechnology, navigation, robotic systems, tissue engineering, and stem cell technology have revolutionized orthopedic surgery today. The next 2 decades for the surgeon, the teacher, the student, and to the patient will be most fascinating period in the history of orthopedic surgical pursuits. But we should also remember and realize that we are a country of 1 billion people. 30% are below the poverty line still, and have no access to potable water and sanitation, leave alone good health care. 28% are still uneducated, which is little modified today. and 15% have some sort of insurance and medical support, and another 20% are rich, they can afford any line of treatment. Another 40% are in the middle group, whereas nearly about 20% cannot afford any line of treatment. We should also realize this change is necessary. Change, as I told you, change in our outlook and implementation of our dreams. I do not pity surgeons who do not realize their dreams, but I indeed pity surgeons who do not have dreams to realize, who do not have aims to aim and goals to be scored. So it is time we change our teaching to problem-based learning and our patient care and surgery to be innovated to the needs of our patients in India, taking sometimes even the financial background, their occupation and livelihood in the villages. It is very easy to say with a bad OA hip that joint replacement is the only answer. We will have to find some solution to help these poor farmers in the villages. Coming to research, no science, medicine, agriculture, economics, or veterinary, physics, or chemistry can survive unless we undertake research. We, the physicians and surgeons in India, have miserably failed in this endeavor and wasted our large number of resources of our patient strength, not put into perfect use. I was just going through the last 5 years from the PubMed. 4,604 articles were reviewed on THR, 240 on osteomyelitis, 359 on clubfoot, and just 9 on neglected clubfoot. From even in these, the authors from India were only 0.04%. Patency rights taken from India were less than 0.2%, though our clinical material is abundant and much more than any other developed country, except perhaps China. We will have to take a stride. But I was happy to get the source of current medicine research and practice recently. 4 of our Indian institutes are in the global list. We would appreciate Massachusetts in US, 46,000, where the AIMS is 11,000. And that is the story. And all the other do not even reach the 100 mark. Excuse, unfortunately, given by our doctors is we have no infrastructure facilities. Gentlemen, Alexander Fleming, Thomas Alva Edison, or Lord Lister, or Joseph Hunter, or even Gabriel Elizardo did not have any advanced laboratories for their work. It was their tenacity of purpose and willpower which made them immortals. What is required is motivation and innovation. We have to motivate and innovate to the needs of our patients. Unless we innovate and run with the present changes, we'll remain armchair surgeons and cannot be leaders in our profession. Publish. To have an international standing in orthopedics, we should publish. For publishing, a practicing orthopedic surgeon has equal opportunity as the senior most professor in a medical college, mind you. Coming to record keeping, unfortunately, not even 1% of our doctors, neither hospitals have a perfect record system even today. To be effective leaders in medicine, records are vital tools. Gentlemen, we are living in an evidence-based world. But with the changes, we are so much bogged down that every simple fracture is raped with internal fixation. Every other joint is either scooped or replaced without a proper indication. By this, I do not mean to say internal fixation and joint replacements are bad. They are the best tools today. Only we will have to do our best, and the indications will have to be very definitive and the surgery to perfection. To be successful in the life of an orthopedic surgeon, basic mechanical aspects and internal fixation of fractures can never be eclipsed by new fixation devices, mind you, whether it's anatomical plates or ceramic on ceramic. In treatment of fractures and diseases born, a surgeon should be a gardener and not just a carpenter. I feel the patient and the relatives are confused today. So a team of doctors in every hospital should plan the treatment and execute it to perfection. All of us are not divine, but if a patient requires a better care, as per the latest evidence, he should be given that particular choice. Do what is right for the patient, for this beautiful editorial from the American College of Surgeons in 2016. Look at all these fractures, how badly they are fixed to the agony of the patient for lifetime. And look at this nail, even Gerard Kuncher would turn in his grave if he sees a fractured femur being nailed like this and like this. And look at these joints, the knee joints so poorly executed and the hip joint being replaced in that way. Look at these are unimaginable types of internal fixation. Each one of these patients have a story to tell us as to the misery they have undergone, including loss of jobs, finances, and pain, and could have been prevented with a proper initial treatment. But look at this ideal fixation. What is required is little innovation, better training, and execution of the job to perfectly. Each one of these fractures have been fixed perfectly. Each one of these upper limb fractures have been fixed very well. Look at the joints, each one of these, whether the knee or the hip or the elbow or the shoulder, different types of replacements fixed to perfection. But what is important, my message is, do no harm if you cannot do any good. Primum non nocere. Life has become, no doubt, much easy for you and me compared to what we used to struggle 50 years ago. But remember, you shall not do any harm. Ethics and philosophy is the very basis of our professional life. But we should remember that modern orthopedics as a science is unique. That along with science, technology, and logic, it demands precision. Apart from empathy, integrity, and hard work, integrated with its rich ethics and philosophy. And what should be done? And what should be done beyond our professional life is also the topic given to me. Look at these Vedas words, Vaidyo Narayano Hari. Doctor is indeed described as a Narayana. Show me one other profession anywhere in the world where a profession is treated as God. To quote the famous words of our own pride of Karnataka, the national poet Kuvepu, Nanu Dinanitya Unnuva Kudu, Nanna Bevarina Honeyagiraveko Horatu, Parara Kannira Dareyalla. Parara Kannira Dareyalla. To translate in English, the daily bread which I earn should be the toil of my sweat and not the tears of the common man. Coming to life beyond professional life, it's the pity that amongst all of us, almost all of us are so busy, including you and me and all the 8 of you sitting there, in our own professional life, that many of us do not enjoy the other side of the coin, like the beautiful sunrise or the sunset, flowing rivers or the seashores or the mountains, the music of Lata Mangeshkar or Manade or Rafi, or the arts and traveling, and even the enjoyments of sports achievement. Start loving at least one of them, gentlemen. The peace and harmony you get is entirely different when you pursue one of the practice and see the difference you attain. When P.V. Sindhu won a bronze, or that wonder girl Mirabai Chanu won the silver, or a boxer Lavlina, though she lost the silver or the gold, she still won the bronze today. And when our men's hockey team beat Great Britain, the pleasure I went through as a sports lover was indeed immeasurable. Join organizations like JCs, Lions, Rotary, Bharat Vidya Bhavan, Sangeet Academies, sports clubs, even politics, why not? But you must love it. You cannot serve collectively in this you can serve collectively in this organization. As an individual, what you cannot do by joining any one of these, collectively you can do a lot of things and enjoy life. I come to time management, which is so important as an orthopedic surgeon. And time is the very essence of life. If you love life, then you do not squander time That is the stuff life is made of, said Benjamin Franklin. Benefits of time management are you are more efficient, you are more successful and healthy. Time management is not a way to make you work harder and longer, but to help you to work smarter and make work more easy and praiseworthy. That is the very basis of what you do beyond your professional life. And look at the benefits. John Kennedy was a great stickler to time, and one of his main points of success was time management. Yeah. Alexander Fleming used to work till 2 a.m. in the morning in his laboratory and start work again at 7 a.m. in the morning. Sleep physiology had no meaning for this great inventor. John Chanley, whom all of us consider one of the greatest orthopedic surgeons, would not sleep till his goals were reached. His 7 to 8 a.m. case discussions and ward rounds used to be the most sought after and perfectly timed. And Sir John Major, former UK Prime Minister, resigned in the year 1997 at 11 a.m. and he was seen at 2 p.m. at Lord's Cricket Ground watching the cricket test. His example shows, gentlemen, how to balance life and your work and go beyond your profession to enjoy life. Obstacles for time management delay in reaching your objectives are unclear objectives. You do not know what you want to do. Disorganization. You are too much involved in too many things. And appoint a committee, just government. That's the best way to take off what you want to do. And go to the court and get into trouble. Time savers for physical activities or physical exercise. If you do not have time, do just 15 minutes, go to the gym or just practice yogas or pranayamas. Don't use the lift, walk briskly even in your hospital. Learn the art of saying no. Many times we succumb when a friend says, oh, come on, we will have a drink. What list you have next day morning is important. Maybe a drink or a jalebi or parties and functions is the most important saver of time. Politely say no. I'm sorry, I have another important function. Procrastination is a beautiful English word which says, do not postpone your dreams to the next day. Whatever are your dreams, whatever you want to do that day, finish it off that day. Somebody is speaking, Ravi is speaking on health and family. Yes, it is so important. Family life, children, friends, relegate time to them. Eat once a week, at least together with your children, because the time factor is so important. Take your wife and your children, get out and enjoy. A well-knit family is the most important adjuvant for success, mind you. Your parents, the husband and wife should be the role model to your children. I always say that it is the parents and the teachers who should be the role models to the children. Find time at least once a month. Plan. Undertake social commitments, which is important. You must be recognized socially and you must be recognized in the society. Be a part of it. Look at many of the successful surgeons. They are a part of the society at large. You can't be within the four walls of your theater making money all the time. Look after your health. Health is wealth. To do away with stress of profession, exercise. Listen to music. Watch a football game or meditate in your free time. Find time for it. Finally, whatever you have succeeded, celebrate it. Your success with family and your friends and with your juniors in the hospital. Celebration, it rejuvenates your system and your colleagues with better adrenaline flow, well-being, and it gives peace of mind. It has been proved beyond doubt. Gentlemen, 20 years from now on, you'll be more disappointed by the things you did not do than by the things you did do. So explore, dream, and discover life apart from orthopedics. There is so much to give than just to take. There is so much to give than just to take, said Mark Twain. In short, to be leaders in orthopedics and at the same time enjoy and lead a peaceful, harmonious life. Work hard, manage your time, be a part of the society, and give your share for its development. Build institutions. Leave behind your footsteps in the sands of time for people to remember. Well, here was a surgeon who meant what he wanted to do and left behind his footsteps. In the end, it is not the years in your life that count. It's the life in your years which counts, said Abraham Lincoln. Look at Swami Vivekananda. He died at the age of 39 years. And Adi Shankara died at the age of 32 years. And John Kennedy was shot at 46 years. All these people proved to the world, age is not important, but what he achieved is important. That is vital in life. To recall the words of Father of our nation, the 7 deadly sins in today's world are wealth without work, enjoyment without conscience, knowledge without character, business without morality, science for you and me without humanity, religion without sacrifice, which we all fight for, and finally the politicians who have done so much harm to all, politics without principles. And what is important is let us all be achievers. We are all proud of our Karnataka Orthopedic Association and I. Let us be examples to our colleagues that knowledge, ethics and philosophy of good orthopedic and medical practice is our power. But beyond that, let us thank God for his great gift to us to have made his orthopedic surgeons. As leaders in orthopedic field, let service ennoble us. Let compassion to our patient mellow us. Let justice be the guide to all our actions. But gentlemen and my colleagues, enjoy life. Enjoy life. Remember, you can live only one life, and that's the only life. Thank you very much indeed.
Thank you, sir. It's one of the finest lectures I really heard in the recent past. I'm sure it's worth relaying once again to all our listeners. It's been just outstanding lecture. I'm sure all agree with me on this. But Bharat, I think you should take note and see that this.
Sir, it'll be on YouTube and IOA TV also.
Yeah, this lecture should go through the country.
Yes, sir.
I'm sure it's. You see, so much of science and philosophy. I'm sure that will make us great surgeons. Sir, thank you very much. This is one of the best lectures I've ever heard. Is there any questions on this? I'm sure everybody will be puzzled to ask anything on this.
I think he has covered every aspect of life.
Sure, sir. I think I with no sense of this thing, I bow to sir on this particular lecture. I bow to him and prostrate before him for giving such morals in life.
Take home message from sir's talk will be: leave your footprint in this society before you leave the this nation.
Thank you.
Yeah, very, very nice. In fact, this reminds me of Professor Weller, who used to always say that first surgery is the best surgery. Do it well. A failed surgery is worse than no surgery. Please don't attempt it. Sir, golden word, sir. We'll take this message always in our life.
Thank you. Thank you very much. Thank you.
Shall we proceed with the next lecture, Bharat?
Yes, sir.
Yeah, I think, is Arvind ready with us?
Yes, sir.
Yes, Arvind.
Yes. Are you all able to see the slide?
Yeah,
Yes,
yeah.
so we can.
Yeah. Now it is clear.
Good evening. Warm greetings to all the eminent panelists and my fellow colleagues, my seniors in the faculty. So from taking off from where you left, one big positive thing is you made my job easier. The negative thing is my lecture could lack luster, because your lecture was profoundly very good, covered most aspects of self as well as family health. Very briefly to put up with what I've got to say on a personal note, considering the recent epidemic, in fact, ongoing epidemic and the coming one, I think conserving one's health and the family health has become a paramount importance to most of us as clinicians, as surgeons, and the entire medical fraternity. Now, looking at personal health, it's not just about mental health, physical health, financial health, also the health status with the relationship status that you share with your friends and family members, which has become very important to keep yourself mentally sane. And financial help, of course, as Mr. Guru mentioned, we need to be very secure without much liabilities, and keeping physical fitness every day, working out, proper nutrition, not indulging in being over nutritious and being a little overweight. I think it's a broader subject. And as I said before, keeping it simpler is the most complex issue. Starting with my slides, what does WHO say? Health is a state of complete physical, mental, and social well-being. And it's not merely the absence of the disease and infirmity. It's a complex web of difficult entities with complex relationship with each other. Positive health is a notion of perfect functioning of the body and mind. It includes biological aspect where every cell of the body is functioning perfectly, functioning to its optimum capacity. Psychological aspect where an individual feels a sense of perfect well-being and of mastery over his environment. Social aspect where the individual's capacity of participation in the social system is optimal. Achieving a state of positive health is dependent on a concept of level of living. It's a parallel term of standard of living used in unique consisting of United Nations, consisting of 9 components: nutrition, education, occupation, and working conditions, housing, housing, social and financial security, clothing, recreation, leisure, and human rights. Food consumption. Consumption of nutritious food, avoiding negative personal habits like alcohol consumption, smoking, helping in physical and mental aspects of health. Education, adequate education for all parts of society, helping in the mental and social aspects of health. Occupation and working conditions, positive working atmosphere with social interaction and achieving targets, helping in the mental and social aspects of health. Housing, adequate living space for people, giving a sense of mental well-being and social security. Coming to social security, a healthy interaction with people in the society, helping in the social well-being of the person. Recreation, exercise, yoga, and other activities, helping in maintaining physical and social aspects of health. Leisure, spending quality time with the family members and planning activities such as family get-togethers, trips with friends and family, and other activities maintaining all aspects of health. Human rights, basic rights of people, of traveling, expressing one's own thoughts, interaction with people is necessary to maintain mental health. Disruption of the determinants leads to adverse effects on different aspects of health, leading to disease, which can be physical or mental. The current pandemic has disrupted the health of individuals in different aspects other than COVID-19 disease itself. Alteration in food habits, alteration in education and poor quality of education, disruption in work environment, unemployment leading to loss of financial and social security, loss of recreational and leisure activities due to lockdown. Self-care, according to WHO, is defined as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of the healthcare provider. Self-care is a broad concept which also encompasses hygiene, nutrition, lifestyle, environmental factors, socioeconomic factors. The core principles around which the self-care depends on fundamental principles of self-care include aspects of individual Example, self-reliance, empowerment, autonomy, personal responsibility, self-efficacy, as well as greater community. Example, community participation, community involvement, and community empowerment. Supporting self-care interventions has the potential to strengthen national institutions to maximize efficient use of domestic resources for health, create health sector innovations, including by catalyzing digital and mental health approaches, and improve access to medicines and interventions through optimal interfacing between health systems and sites of healthcare delivery. Impact of COVID-19 on families. So with the COVID-19 as the background, what is the impact on families? How should parents explain to their children about COVID-19 and its effects? One thing being very honest and using the right module. In talking with your children with COVID-19, it's important to first and foremost ensure that you have an open and supportive environment where children know they can ask questions. In answering questions, you have to be honest. Children will usually know or eventually find out that if you're making things up. This can affect their ability to trust you in the future and be reassured. How to explain the importance of social distancing to teenagers. It's helpful for teens to understand the rationale for social distancing and how if someone doesn't appear ill, they could still transmit the virus. It is also important for them to understand that social distancing is important in stopping the spread of the virus, not just for their protection. What should parents avoid telling their children at this time? It's important to model calmness and not spread panic, and to do your best to try and shape their environment. In this regard, we should try and avoid allowing our children to watch too much of exposure on television or media with disturbing or frightening and unrealistic images. As noted in recent guidance from the American Academy of Children and Adolescent Psychiatry, the repetition of such scenes can be disturbing and confusing. If COVID-19 is forced a family into financial hardships, what is an effective way to explain this to children? If kids have questions about COVID-19 or about why things in the family might be different because of financial difficulties, answer them with honesty, but reassuringly using words and concepts that they can understand appropriately. So coming to personal protection, how to protect yourself and others. Using masks, we should wear a mask in indoor public places, indoor as well as public places, irrespective of the vaccination status. The recent developed nations who have given indications about not wearing masks. We have seen the second wave or third wave being very imminent. Stay 6 feet away from others. Inside your home, avoid close contact with people who are sick. If possible, maintain 6 feet between people who are sick and other household members. Avoid indoor spaces that do not offer fresh air from the outdoors as much as possible. Outside your home, put 6 feet of distance between yourself and people who don't live in your household. Avoid crowds and poorly ventilated spaces. Being in crowds like in restaurants, bars, fitness centers, or movie theaters puts you at high risk for COVID-19, which we all know, but definitely we should educate others as well who are not in our field. Hand washing. Wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in public space, or after blowing your nose, coughing, or sneezing. If soap or water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public space, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, and after touching animals or pets. Hope this doesn't lead us to a term called as obsessive compulsive disorder. Been washing more than ever, made up all the number of times you've not washed before. Cover coughs and sneezes. If you are wearing a mask, you can cough or sneeze into your mask. Put on a new clean mask as soon as possible and wash your hands. If you're not wearing a mask, always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow and do not spit. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with hand sanitizer that contain at least 60% of alcohol. Clean and disinfectant. Clean eye touch surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If someone is sick or has tested positive for COVID-19, disinfect frequently touched surfaces. Caring for someone sick at home. If you're caring for someone with COVID-19 at home or in a non-healthcare setting, follow this advice to protect yourself and others. Provide support, help cover basic needs, make sure the person who is sick drinks a lot of fluids and rest and take medications on time. Help the person who is sick follow their doctor's instructions and care and medicine. For most people, symptoms last few days and people usually feel better after a week. See for over-the-counter medicines for fever, help the person feel better. Help them with groceries, shopping, filling prescriptions, and getting other items they may need. Consider having the items delivered through the delivery service. Watch for warning signs like trouble breathing, persistent pain or pressure in the chest discomfort, new confusion or delirious status, inability to wake or stay awake, pale gray or blue colored skin, lips, or nail beds, depending on skin tone, should be an indicator for hospitalization. Limit contact. The person who is sick should isolate. The sick person should separate themselves from others in the home. If possible, have the person who is sick use a separate bedroom and bathroom. If possible, have the person who is sick stay in their own sick room or area and away from others. Try to stay at least 6 feet away from the sick person. Shared space. If you have a shared space, make sure the room is well ventilated. Open the window to increase air circulation. Improving ventilation helps remove respiratory droplets from the air, so creating a negative air pressure in the room. Avoid having visitors. Avoid having any unnecessary visitors, especially visits by people who are at high risk of severe illness. As I said, we've got to clean hands very often, clean surfaces and objects much more than earlier. Track your own health. Caregivers should stay home and monitor their health for COVID-19 symptoms while caring for the other person who is sick. Symptoms include fever, cough, or shortness of breath, but other symptoms may be present as well. Trouble breathing is more serious warning sign that you need medical attention. Caregivers should continue to stay home after care is complete. Caregivers can leave their home 14 days after their last close contact with the person who is sick based on the time it takes to develop illness, or 14 days after the person who is sick meets the criteria to end home isolation. Thank you.
Dr. Surya?
Yes, sir.
Anything you'd like to add, sir?
Thank you, sir. This is really a refreshing for us in managing our personal as well as family life and to prevent and be safe from COVID. Any questions?
Yeah, he's given a lot of tips.
Yes.
Really to how to go about. I'm sure to talk after Professor Shantaram Shetty. It is not, I could recall one instance, Bharat, in one of the IOAs where I was on the stage, in one of the conference, meetings there, I was requested where Shantaram Shetty and many other dignitaries were on the stage. I was requested by one who was supposed to give the main lecture speech that don't allow Dr. Shantaram Shetty to speak before me. This was quietly told in my ears. I recall this instance, and I presume that's why you have put Shantaram Shetty last today, so that everybody stay back. But anyway, Dr. Arvind, you have covered wonderfully well. A lot of practical tips. I deeply appreciate those tips, which should be really taken up. And I once again thank you for presenting these concepts here. Okay, Bharat, can we go on with Dr. Purushottam, the most awaited man always for this thing. He has something new always. Yes, and he's a very good friend of mine, a great well-wisher of mine also, as Bharat is much. But Purushottam always adds something life there. So I would like to really look into what is that new life he'll add into it. Yes, Purushottam.
Thank you, Dr. Rajendra. Thank you very much. You are always there to pull my leg whenever it is required. And I appreciate it always. Good evening, everybody. And let me first share my screen. Okay. You can see the screen now. My screen is
Yeah.
Thank you. Thank you again, and thank you KOA and IOA for giving me this opportunity to speak on one of my favorite topics, work-life balance. I'm sure after having worked about 33 years in government service and about 30 years in my private practice, having just retired and rejoined a new medical college as professor, I must be able to do some justice. But I was little worried if I can do this justice within 20 minutes. When Bharat cautioned me, it has to be within 20 minutes. And now Rajendra has threatened me that speaking after Professor Shantaram Shetty is going to be an uphill task for me. And I consider it will be uphill task, but I will try to do justice. And about time, Bharat, I will definitely contain within 20 minutes because Professor Shantaram sir has covered a couple of my slides, and I will cut down about 3 to 4 minutes. Thank you, and I'll start again. So what is this all about? Why are we so much stressed about this life-work balance or work-life balance, whatever the way you look at it? Look into any media, paper, newspaper, or other medias. People talk about this. It is actually in philosophy, in principle, it is a prioritizing between work and life. Work is your career and ambition, and on one hand, and health, pleasure, leisure, and spiritual on other hand. This is how, if you are able to balance these two, I think you lead the complete circle of life and you are the happiest man on the earth. If that's what we are looking for, let's see how we can do that. So why the need for balance now? Why not we allow life to take its own course and work to take its own course? It used to happen way back in when we started our profession some 30, 40 years back. But now this is more stressed down. Why? It is one reason is you have to maintain your mental and physical health, and that is the crux of your well-being. And definitely you need to balance work and life to have your physical and mental health balanced. And definitely it will increase the productivity in your workplace if you are balanced life and work as needed. And definitely you will become a more rounded individual or accepted individual, which society needs and which we are all striving for. We are all looking forward to be allowed in the society. But finally, what I would endorse what Professor Shantaram told now, you only get one life after all, isn't it? There is one life for all of us, and that is the life we have to live the fullest. And why not put some effort to balance it? That is what we are going to look at in this presentation today. I'll try to, I think many of you must have heard more of this talk in the recent past. I'm only trying to make it, a little practical way, how we can look at balancing in a very comfortable way. Now, the question is this easy, as easy as what this picture says? Look at this cartoon. This doctor says he can bring the practice to his living room and he can definitely balance the work and life. Is it so? No, I don't think so. It is not as easy as what he says. Or is it as difficult as this elephant? What you see in the circus, it can only happen in the circus, isn't it? An elephant balancing on a softball like this, is it as difficult as that? I don't think so, of course not. Or is it as elusive as this picture, what is being depicted in this picture? I don't think so. It is not at all. So I don't think it is as difficult or as easy or as elusive as what this picture showed now. So let's see, briefly we'll look into what are the reasons for imbalance of this work life. Poor planning. I'll tell you, my dear friends, poor planning is one of the biggest concerns, whether it is in work or in your life. What you need to plan. If you fail to plan, if you don't stick to the plan, what you have planned, then poor planning erupts and you are losing the balance there. Next one is poor setting of priorities. We need to set our priorities very well, whether it is work, whether you're working in a government setup or in a private setup, or in a corporate setup or in your own clinic, wherever you need to set your priority. In this years, in this many years, what your priorities, and also in the life, like marriage, your home front, like wife, kids, and then you need to have a car or house or vacation, whatever the luxury you need to have. The priorities should be set. If you have these both, then it is possible. Basically, it is within you. You are the person, you are in charge of these two. Planning and priorities is definitely by you, not by others. Nobody can dictate you. Nobody can tell you, you do this, you do that. People can, some leaders and gurus can influence you, but your planning, your priorities definitely tailor-made for you, and it is to be done by you. And in case you feel it is outside your control, you think it is not possible by you, then definitely it needs some retrospection. You have to look back and retrospect what is wrong, why my planning is going wrong, why my priorities are not right. And you may need some external help then only if you are failing to do that. We know that effects of imbalance are poor mental and physical health. Definitely that is going to impact in a big way. And definitely it will you will land in unresolved conflicts, whether it is workplace or in social front or in your home front with your children or your wife or friends. You'll have many conflicts, and finally stress and misery is what you're going to have. So you have to balance your work and life to avoid all this. Look at these three. I think these are the supermen I adore. I think all of us adore, isn't it? There are many like this. I'm definitely not talking about these three. No, not at all. No, they are supermen. They have super capacity, super ability. We are not talking about them. They have thrived hard, worked hard. They have reached the spot. They were there or they are there now. And they somehow, we do not know how they maintain their life and work. We really do not know, but they did, and they conquered. I'm going to talk about we, me, you, and rest of us, about 99% of us. I think only 1%, I'm sorry if I'm understating something here, only 1% of us can be of this status. So let us see, looking at all this, what I thought is, looking at my life and my this many years of being in service, in being in practice, being in my life with married to my wife for pretty long years, and my daughter being married. And I don't have to boast many, but I can say I had led a decent, I would say a good life. So with all this, and looking at some of my friends and families members' success in their life and work, I have some tips to give the audience now. I would call this as 10 tips to retrieve the balance of work and life. The first one is, please realize career isn't an emergency. Why? Why is this rush? I think the younger generation is a lot of rush.
Dr. Vishal.
Hello.
Dr. Vishal.
Yeah. So career isn't an emergency. You have to give time to your career to evolve. It's not an emergency. Slow down. Plan it by prioritizing your goals. That is very important. When I came to Bangalore in 1988 after my post-graduation, things were different. We were not in such hurry. We planned. We looked at the life, and we looked at our career at one aspect, at one angle, and we planned how it should be. And another important aspect of being in rush is draw a line between need and greed. It's very, very important, because you never know. There's a thin line between need and greed. You never know when you cross this need and go to the greed level. And if you are into the greed level, you are done, because it is never ending, and you are an unhappy man forever. Second tip, find joy and passion in your work. Definitely, I think anybody who ever has spoken about life and work balance, or ever anything about philosophy, I'm sure even Sir must have spoken about this. There must be some joy and passion in your work, whatever you do. In fact, I would say whatever you do in life, there should be some joy and passion in whatever you do. I don't know. Dr. Rajendra will definitely agree with me. In our Bangalore Orthopedic Society group also, we keep discussing. Lot of my fellow members are little unhappy with the profession they have chosen. They keep commenting. They keep comparing their profession to software engineer, another profession where they start earning early in life. Why? Why is this? Haven't we embraced this with a lot of passion and happiness? We struggled to get MBBS seat. We worked hard, we passed, and now why? So finding joy and passion in your work is very important. Another important thing at your workplace and in life is avoid multitasking. I don't know why this has creeped in our practice these many times. We are trying to do multi-level things in multiple times. No, I think you should focus one at a time. I know you like life is not in a hurry. Career is not an emergency. Avoid multitasking and you will have time for everything what you have prioritized in your life. Third point, go beyond only working hard, work smarter. I know all of us, my parents told me you have to work hard. My grandparents told you have to work hard. My teacher told me work hard. My mentor says you work hard. My friends never tell me that you work hard. So working hard is very important, but I feel not just working hard, you have to work smarter. You should know how to get the best out of your working situation. That is working smarter. And make work more flexible. Don't be so rigid about your work, especially we being in our profession of orthopedic surgery, where surgical skill is at the helm, then we have to be a little more rigid. And we know different schools of thinking for different fracture fixation, different area of our treatment aspects. So we have to be flexible in our work. Don't be rigid about one concept or only one thinking and narrow-minded about your work. Stop being perfectionist. You may not agree with me. I'll tell you, this is one of the things we have to avoid. No perfectionist is a perfect person, I would say. If any students are listening, they would laugh at me because I was once known to be a perfectionist. I tried to be perfectionist. I landed in a lot of trouble, stress, and agony. Then I realized it's not good to be a perfectionist. Yes, recently I was listening to one of the Hollywood actresses in an interview about 3 to 3 months back. She was telling when she was asked about who's the best looking man, then she was telling, if there is a bit of imperfection in his look, I would prefer him than a perfect looking man. So that is just a side of example what I'm giving. Stop being perfectionist. Try to be a perfectionist, but stop being a perfectionist. It definitely makes you miserable. Know your limits. Definitely, draw a boundary. This is where we go completely wrong. I think I am seeing a lot of my students, my younger generation surgeons go wrong in about knowing their limits. You should know your limits. I learned this many years back, and I learned my limit, my capacity, my ability stops here, and I won't get burnt by pushing things beyond my capacity, my limit. For example, in my practice, the moment I see there is something which I cannot handle, I identify who can handle it better, and I refer that case to him. Why not we do that? So that you live and you let others also live. Know your limit is very good. And one important thing for doctors, not just orthopedic surgeons, I'm talking about all the doctors with whom I have met, learn to say no. Even Professor Shantaram said this one. Why not? Is there any ego preventing us for not saying no? I don't think it should not be. Learn to say a polite no when you do not want something, you do not have the capacity to do, you do not have a knowledge about it. So learn to say no when the no is required. Do not get into a rat race. This is another thing. I was telling you about need and greed in the first point, isn't it? So when you cross from need to greed, then you get into rat race. Rat race is nothing but unhealthy competition. We all know to be level-headed, to be on par with our colleagues, we have to have a good, healthy competition, but don't get into unhealthy competition, which which, acrimony, and which will culminate in lot of anger and lot of bad blood flowing around. So another thing is, rat race is about competing with another person. Like somebody has a BMW car, I should have the BMW. Why is that? No, you identify your goal and priority and what is yours. Not, you don't cut and paste or copy and paste another person's requirement, his ability, his capacity, his knowledge. So if you try to do that, if you want to emulate somebody, no, I want to have what he is possessing, then the race might go on till the very end. Where is your time for the life? Where is your time for happiness? You're lost somewhere. You go to go to a race where there is no finish line, and your misery will be continuous. Do not resist change. Point number 7. Do not resist change. We all know, all walks of life, there is so much of updating happening. There is so much of things flowing. New things are happening. We have to update ourselves. We have to change to the circumstances, to the society, to the world, to the universe, isn't it? Live in the present moment. Update yourself in your workplace, maybe in your profession, in your surgical skills, or your teaching knowledge, wherever it is required. Come to the home side, like in a life front. You have to update yourself according to the recent developments, recent needs and changes the universe has taken place with your kids or children or wife or your friends. I think most importantly, friends, I would say you have to update yourself. Take time out for yourself and your family. Professor had already mentioned about it. Definitely, this is one of the most important things to balance your work and life. Unless you find some time, I know we are in a field where we do not have much time. We don't get free time. We are on the go for 24/7, but then find time. I have a couple of close friends who are very workaholics, but they still find time to spend out time with their family. I'm not telling you have big vacation. Yes, you should have weekends, month ends, or year ends, and international vacations, whatever, plan it. But then, staying at home for one complete day, switching off your mobile, switching completely off from your work or your profession is also a vacation with your family. All that your family requires is you and you and you. Your children, your wife are looking for you, and you have to spend enough time with your family. And sometimes I would also, I see that I give a little share of my time, my space, my precious time to my friends also, closest friends. I form a group of closest friends and I spend some time with them also. This is, I think, a way to happiness. Don't miss life's little pleasures. Professor Shantaram Shetty sir told all of those little pleasures which brings happiness. I'm not talking about momentary or short span pleasures. We are talking about pleasures which can bring happiness. There's a distinct difference between pleasures and happiness, as we all know. So I'm talking about pleasures which can bring happiness, be it music, be it some spiritual discourses or sports, or some recreation activity, whatever. Find time and definitely you will enjoy, and it will bring a lot of happiness, and that will tilt the scale towards life balance, certainly. The 9th one is health is wealth. Dr. Aravind spoke about how important it is to take care of your one's health and your family's health. I don't know why we are being labeled as the worst patients. I feel the doctors are the worst patients, including me for some time back, I would say. See, I see many of us, even though we have a lot of complaints and ailments, we never get evaluated ourselves. The moment we see some patient with the same complaint and ailment, we ask for battery of investigations, evaluations, but we never get it. Why? We have to periodically go for regular checkups and evaluate ourselves to keep fit and physically and mental. And again, pamper yourself. Nothing wrong. You have to. Who else will pamper your body? Who else, and how many long years? You're near and dear and you can pamper your body. It's you. You have to pamper yourself. Find a way. There are many ways of retail therapies now available. like massage, spa, whatever. There are some good naturopathy treatments, such things. Pamper yourself with such things. And lastly, like Professor said, celebrate your success. Why shy from celebrating your success? Don't look at this picture. I'm sure Rajendra must be definitely looking, this is Purushottam. No, I know that there are many ways of celebrating, but I say celebrate your success. You have to celebrate. The success is to be shared among your families, your friends, and your colleagues. It is not to be hidden, whereas your failures are for yourself. Don't dwell on your failures. Your failures for yourself. You learn on your failures, isn't it? You grow on your failures. So celebrate your success the way you celebrate, not the way this picture is showing or whatever, the way you can imagine. And don't dwell on your failures. Look at this beautiful sentence. I love this. In every speech of mine, I keep telling this. The American and English poet T.S. Eliot has, how beautifully he has stood. It's not the destination, but it's the journey that matters. How beautiful is this? It's not where you want to go. It is how you go. It is more important. The spot where you want to reach is very important. Destination is, but how you reach there. For example, if you ask me if I have to go to Mangalore today, I would love to go to Mangalore anytime. I don't know why Mangalore people are not inviting me after that oration in September. Professor Shantaram Shetty must be listening to me now, if at all anybody else is listening. I would like, even now, I would like to drive, even at the age of 60, I would like to drive and reach that place than taking a flight or something. That apart, in life and in work, the way you do, how you do is more important than what you have done at the end. It's happening. It's happening everywhere. What's happening? This talk of life and health is happening. Look at this. This morning I was going through the newspaper. This was the item in one of the main pages. World won't stop if you take regular breaks from office. This was the interview by one of the CEOs of one important multinational company. It won't stop. World is not going to stop just because you have to work and do you want to keep the world alive? No. It will go on. The world will go on till it. Okay. And in the same newspaper, there was another news. Bill Gates and Melinda officially divorced. Today's newspaper. So this news has been going last 3-4 months. So I was telling about Superman, and I said their success, which cannot be measured in any yardstick, but we do not know how they managed their life and work. But as you see this news, be surprised for some changes, some surprises. Be prepared for some surprises, changes that can happen in your life. So we should be ready for such things in our life too. And if at all, lastly, if at all, there are many I come across who think they're always unhappy. They are not happy with their things, what's going around. I think spirituality is one of the ways of finding happiness. I think many of you must have read Robin Sharma's The Monk Who Sold His Ferrari. A lovely book. First reading may be boring. Read second time. I read it for the second time and realized a lot of, I was never spiritual. I'm little into spirituality now. So it's not completely spiritual. It is a way, a path to show happiness on the way to your success or whatever journey you have taken. So this is all about how you can work life and the balance, how you can strike a balance between your work, whatever the profession you have chosen, and life, whatever the life you have chosen. And happiness is the key word. And definitely we have to see that we will be happy forever with balancing as much as possible. I thank KOA President and Secretary for giving me this opportunity to talk on this topic. Thank you and good night.
Okay, Purushottam, wonderful. I could see a great bit of shadow of Professor Shantaram Shetty's lecture in you. I'm sure you would be better, more, and would like to hear you more often. I'm sure you're maturing very well in these speeches. And definitely, I'm sure the audience would agree with this. One more tip to your 10 tips is, too much of analysis will lead to paralysis. So I think we need to add that. And you said working hard, work smarter. Yes, I have realized that an obedient donkey will carry more load always. And whenever you say yes, when you have to say no, you'll be in trouble. Well, today being a bone and joint day, I would like to just share a small joke with all you guys. You see, there are two old couple who are married, and always the wife, "Nanu enu madilri ನೀವು ಏನು ಮಾಡಿಲ್ಲ," the wife is to tell. The husband, "Don't worry, ನಾನು ಸತ್ತು ನೀನು ಏನಾರ ಮಾಡೇ ಇಡ್ತೀನಿ" ಅಂತ. So one day when they were going out, they meet with an accident, and this old man has multiple fractures. I'm sure he lands up with Bharat Raju or Purushottam, who puts all sorts of implants on his body, right? Radius, ulna, femur, everything. After the anesthesia, when this patient gets up, he's 4 kgs more than his normal weight with all those implants. Then the surgeon reassures, "Don't worry, you have become a steel man today. We are very proud you are." So convinced with the fact that he's a steel man, he goes out on a cloudy day, and to his misfortune, he gets killed by a lightning. When he gets killed with a lightning, his wife, "Ayyo, satta, yun yen martini, yenu madlilla," anta hebbitu satta. Finally, when he was cremated and the funeral took place, when they went to collect his bones, they got one bag full of all these metallic implants. Okay, so his wife didn't know what to do with this. She could not throw it into the river Ganges. She gave it to a blacksmith. She said, "Yes, madam, our ಹೇಳ್ತಾ ಇದ್ರು ನಾನು ಸತ್ತಾಗ ಏನೋ ನನ್ನ ಹೆಂಡತಿಗೆ ಮಾಡುವಂತ ಬನ್ನಿ." Then when she goes the next day, he gives a beautiful walking stick for him. "Please rest on me. I'm still helpful to you." This is the bone and joint days. This is a small joke on the bone and joint day. So I wish we all, going through all little IOAs, this thing, I'm sure Shiv Shankar agrees what all he went through. And if this I changes to we, I'm sure illness changes to wellness. So we should all work together, uplift the IOA. I thank Bharat for giving me this opportunity to moderate this wonderful session. I look forward to more this thing. I thank all our speakers, excellent talk. I'm sure we'll all enjoy this evening. Surya, anything more to add, sir?
Yeah, we had a very wonderful session, sir. We must thank the President as well as the Secretary for choosing the good panelists. And as Dr. Purushottam said, you must enjoy the journey than the destination, and give enough time to your family and balance yourself. I think that is the take-home message from his talk. So thank you, sir.
Thank you.
Once again, thank you for KOA and Bharat and the Secretary for giving us the opportunity. Probably we'll catch up again soon.
Sure.
Yeah, thank you.
Thank you.
Shiv Shankar sir, you want to add something? Shiv Shankar sir?
Unmute.
Sir.
There's nothing much to add, but I thoroughly enjoyed the talks by Dr. Shantaram Shetty sir and Purushottam also. Yes, we all hear from great leaders when they talk about work-life balance, that they enjoy work. But unfortunately, as he rightly said, they are the top minuscule percentage of people who will be successful, and we will be calling them only every time to speak also. That is another part, unfortunately. And we should look into the remaining 99.9%. What Dr. Purushottam has done today is extremely good. He has looked into that part of the segment, not the top 0.1 or 0.001%. How many such a successful, any entrepreneur, like what he showed, Bill Gates or Bezos, anybody are available. So for every person who is at such a state, there are so many hundreds and thousands who are in the mediocre or middle order level. So we should also consider them, and that work has been done very excellently. And even I enjoyed the talk on by the internal medicine Dr. Arvind about the self-help, especially in the time of COVID, and also the Guru talked about the financial health. Very important. That is one of the reasons why I stayed right from beginning till the end, though I was out for a few minutes just to inaugurate another webinar of West Bengal in between. Thank you very much for having me here today. I really learned a lot.
Thank you, sir. It's an honor to have you amongst us.
Thank you.
Now, I request Dr. Ravish to present the word of thanks.
So, I would like to thank the organizers, Dr. B. Shivshankar, IOA President, Dr. Naveen Thakkar, Secretary of the IOA, Dr. H.S. Chandrasekhar, the President of KOA, Dr. Bharat Raju, the Secretary General of KOA, and the speakers, Professor Shantaram Shetty, sir, for a great speech he has given, Dr. V. Pushwatam, Dr. M.N. Arvind, and Dr. Guru Prashant. And I would like to thank all the moderators, Dr. K.V. Rajendra and Dr. Surya. And I would like to thank the President-elect, Dr. Ashwini Kumar Singh, the past President Mallikarjun Swamy, Dr. Satish Sarvekar, the coordinator for this, Dr. Vamshi, web coordinator, and our Alembic Pharmaceuticals who are our online team. It was a great one for the Bone and Joint Week. Thank you, everybody.
Thank you, sir.
Thank you very much. Thank you.
Thank you, sir.
Thank you. Stay safe.
Thank you, sir.
Dr. Shivshankar, Professor Shantaram Shetty, and Bharat, Rajendra, Satish Sarvekar, all speakers. I thank everybody for conducting this program very nicely. I really enjoyed this program. Thank you very much.
Thank you, sir.
Thank you.